Are you feeling exhausted and burnt out, but people around you seems like full of energy? Well, in this episode of Behind the Counter, we are joined by Dr. Castelluber and Christine from Inspire Med Spa. They share how they're helping patients regain energy, focus, and balance using personalized protocols and LDN and Methylene Blue. Let's jump right in. If you're feeling foggy or tired or just off, there are compounds that may be able to help you. LDN and Methylene Blue is pretty popular, but we want to make sure that you get the right guidance and personalized care. And they can be a very, very powerful tool. My name is James. I'm a pharmacist at HB Pharmacy, and I'm here joined with Dr. Castelluber and Christine from Inspire Med Spa, and they are leading the ways in functional and aesthetic anti-aging care. Hello, everybody. How are you today?
Hi, James.
Hi, Dr. Castelluber. Please tell us about Inspire Med Spa.
Yeah, at our office at Inspire Med Spa, we try to make a more personalized approach. We do the lab testing. We find specific supplements, and we are very excited now that we can use Methylene Blue and LDN that I use already. It's one of the tools that we have to our patients. So it's for each one. So we have to choose, and then we have to develop a personalized approach for them.
Christy, would you like to add anything?
Yeah, as my name is Christine, I'm a nurse practitioner at Inspire Med Spa, and yeah, everything is very personalized. We like to take everyone's concerns into account. It's not a one size fits all for anyone. So with their lab works, with your symptoms, we use all of that to make a very comprehensive plan and see what the best route is.
So let's start with low dose naltrexone, because this is probably one of the most misunderstood compounds that we know right now. Dr. Castelluber, can you please explain to me what LDN or low dose naltrexone is?
Yes, so LDN is low dose naltrexone, and then originally it's a drug used for addiction on 50 milligrams dosage. But then when you do on a different way, like in low dose, you go for immune modulation, you go for pain, so it have many uses for it. So that's the difference between addiction, that's 50 milligrams, and the low dose, that's the other use for it.
Sure. Christine, can you talk a little bit about the dosing and why personalized approach is very important?
Yeah, so as Dr. Castelluber talked about, at the 50 to 100 milligrams, that's used for the addiction, but at very low doses, starting at 0.5 milligrams up to about 4.5 milligrams, that's for the anti-inflammatory portion of it. So not everyone can tolerate at the 4.5 milligrams. So when we're discussing it with the patients, we make sure that at the dose that they're at, we follow along and make sure that that's the right dose for them. So we can go up by 0.5 if that's what they need, or just keep it at 0.5. Everyone is different. So we go based off of how you're feeling.
Yes, so the LDN, the most important part of it is that it has to be personalized. You cannot just go to any doctor or any pharmacy and just, hey, can I get some low dose naltrexone? It definitely requires a lot of guidance, and then you have to talk with your provider and the pharmacist, and also you have to get a high quality product to make sure that the product is working for you.
Yes, and personal use also. So I myself been using low dose naltrexone for 6-7 years or even more.
Wow.
And then because I used to have immunological disease like Hashimoto thyroiditis, so that's exactly one of the uses for people who have immunological disorders. We can use low dose naltrexone for it. It's not gonna help like for the next 2-3 months, but if you keep using with time, and then the body start reacting, and then we see the result.
So generally, how long do you think it will take for one person to see some difference on it?
I think 6 months to a
About
year.
6 months.
6 months to a year, yes.
Definitely consistency of taking it is not something that you take like an antibiotic, right? And feeling better right away. Have you heard any possible complaints or side effects of the LDN, maybe, Christine, that you're aware of?
Yeah, so fatigue is one of the biggest ones. People waking up very tired. So in that case, we either go up much slower
Mhm.
in the titration of it, or just keep it at the highest dose that the patient can tolerate. I've also, one of the more interesting ones I saw today actually was the tightening of the throat.
Oh, okay.
So in that case, it's very, very low dose, and we keep it there.
Yeah, as a pharmacist, sometimes we can also recommend to break down the dose, high dose into two separate dosing in the once in the morning and once in the evening. We have seen some more help with that as well. So there's definitely different approaches that you can utilize with the low dose naltrexone. One thing that I always like to talk to patients about is don't quit right after
Yeah.
you see some just because you feel a slight side effect. People try to quit. What do you want to talk to the what do you want to tell the audience about that?
Keep with it.
Yeah, we
Yeah.
just have to kind of trust your provider and keep on with it so
And
that
be very transparent with your provider. If you're
Absolutely.
feeling anything, let us know. Don't
Yes.
just stop it and then come 3-4 months later, you forget why you stopped
right.
because you
Yeah.
took it for so little. Let us know, because we want to know. We need that feedback so that we can guide you in how to help, because this is a very helpful medication, and just stopping
and
it.
slowly and
Yeah.
slow, like you have to have time for it.
Yeah.
It's not gonna happen from day to night.
Absolutely. And that's where hopefully the pharmacy can help with our patients as well. Sometimes it's not always easy to reach out to your provider, but you can always call any pharmacy of your choosing to talk more about it. And then the pharmacist will also communicate with the providers as well.
Another thing we can use LDN for is fatigue. Is contrary, if people feel fatigue, sometimes they take it, sometimes it treats fatigue, and then pain, chronic pain,
Yes.
and other things like that. I think even it's helpful for cancer, right?
Absolutely,
Sometimes it's helpful for cancer patients.
And also for Crohn's possibly and the inflammation, the
Yeah,
gut
it goes
as
with the
well.
immunological disorders like
Absolutely.
IBS. I see a lot of
Yes.
improvement with IBS, and that's
Yeah, there's a lot of different uses for it. We
Yeah.
just have to make sure that we use it with the right purpose and with the right guidance. And as of late, there has been a lot of hype about methylene blue. As a pharmacy, we've been getting a lot of questions about it. Now, we know generally what it's used for, like treating malaria and things like that. But can you tell me some little bit about what methylene blue can help with anti-aging?
it's increase like health of the mitochondria, so means energy to the cell and detoxification and for brain fog, things like that.
Yeah,
That's, uh,
yeah, for sure. We've been seeing a lot of effect, especially possibly with the brain fogs and maybe for long COVID. I've been seeing a lot more studies on and cases on the early cognitive dysfunction as well. Do you guys have any customers or patients asking about a possible combination with maybe with NAD and things like that?
they are not asking it yet, but sometimes they kind of mention, oh, I heard about this and I heard about that. So that's something that we have to we can offer them that
Sure,
option.
sure, sure.
As a very good regenerative medicine, we're trying to hit different areas. So with LDN and methylene blue, one's treating the brain, the other one is treating anti-inflammatory. So it's a very powerful combination.
Yeah, for sure. And then there are different dosings that's generally involved with the methylene blue as well. What would be the something that you want to be careful with when someone's on methylene blue?
SSRIs. So if you're on the antidepressants or the psychiatric medication, we have to be aware that can cause some interaction, and we have to be careful about it.
And I also want to make sure to let the audience know is that a lot of times you have your own PCP sometimes, or you have your own pharmacy. And when you're trying to get a different type of therapy or go to like Inspire Med Spa, you have to share all your medications, especially with the doctors and the pharmacy as well. Yes, we're a compounding pharmacy, but we want to make sure that we are checking the interaction with the drugs and then the different therapies. So it is very, very important to tell the doctors and the pharmacist every medication that you're taking every single day.
And supplements.
Oh yes, and
Yes,
absolutely, supplement is a big one. And then
Sometimes you have to dig them
oh yes,
out of them,
absolutely.
the supplement, because you can get interaction with that.
Yes, and there are a lot of supplements, unfortunately, out there that's not being very controlled as well,
Yes.
and with limited study as well, and that can definitely affect your therapy, especially if you're not paying attention to that, right?
Yeah.
I have a lot of customers asking about getting methylene blue from online or just different sources. What's your thoughts on that?
I think we have to be very careful where you get this from because sometimes they don't produce it right. They have heavy metals in it. They don't store it right. So everything differs, and then the result's going to be different. Also, do not encourage them to buy online from sources that they don't know. And the cheaper it is, the more aware it should be because I'm not going to have the good product. And
Right. It's very important because unfortunately, a lot of supplements are not being controlled by reputable places like even the FDA sometimes, right? And then what we pharmacy is that we realize some of the certificate of analysis that they are presenting to the patients are very minimal. Maybe possibly they test one capsule and say, oh yeah, our product is perfectly fine, which is very, very dangerous. So that make sure that you're getting your compounds from the reputable source, and also a lot of the dosing should be changed depending on how they feel, and then
Yes.
you have to have access to the providers after a week of dosing. I don't feel right, then you have to talk to your providers to talk about it and make sure that we are dosing it the right way for you.
Yeah, because especially if you're doing this for anti-aging purpose,
Yes.
for to feel better, and then if you do that with cheap source and everything, you're gonna damage all the health, what improvement you want, you're gonna go all the way backwards.
Absolutely.
So that's the
Absolutely.
most important thing.
I want to talk to a little bit about the combination of the LDN and methylene blue. Christine alluded to this a little earlier. Can you elaborate more on that? How you think they can help together with the LDN and the methylene blue?
Yeah, so like I mentioned, LDN helps with anti-inflammatory. Methylene blue helps with the brain fog and cognitive function. So both of them together is a very good combination because you're treating the different sources for just regenerative medicine.
That's great for sure. And then we want to make sure that it's probably more of a two-pronged approach. But there might be other different therapies that might be able to complement that you guys offer at Inspire Med Spa, right? Can you guys talk some different therapies that you guys provide at Inspire Med Spa?
Yeah, we provide a hormonal bioidentical hormone replacement. We provide IV vitamin therapy. We provide other supplements like uh, GI improvement, the gut lining and everything. So that's a multifaceted approach, and then that we try to do that.
Sure, absolutely. Who do you think Christine might be able to benefit from? Who can benefit from going to Inspire Med Spa? Who do you recommend it to?
Everyone.
Everybody.
That's a very good point because a lot of times, I think a lot of ladies are more susceptible to having these knowledge. You know what, the med spa, and then personalized approach. And I think this is not just but just in general healthcare. I think there's a study out there actually, men are less likely to seek
Yeah.
medical attention. And can you talk about that? Like, what can maybe men and women can gain and they feel better from by coming to Inspire Med Spa?
Yeah, so men, for example.
Yes.
Low testosterone levels, we treat hormones. So that's
Absolutely.
not just women in menopause, it's men in menopause.
Yes.
Andropause.
Yeah, which has a
Andropause,
medical
yes.
term, andropause, but it's menopause.
Yes.
So yeah, it's everyone can benefit from coming to us. We look at the whole picture. It's not just one thing. So if there is a need, we can help them.
And men usually wait for the last minute to,
Yes,
to
they do.
be
They
treated.
do.
So they should start looking at themselves, prevent rather than treat. So that's the new thing. And then everybody should start early. Don't wait until you're 50 or 45 something. You start looking at your health. If you feel good, if you have energy, if everything works properly, and then we should just maintain it. Like a well maintained engine goes a
Yes,
long way, right?
Absolutely. And
Yeah.
you can't just fix what is broken, you have to maintain it.
Yes.
As a pharmacist, what we see a lot is when you go through conventional medicine where you hit age of 40 hypothetically and you are gaining weights and the doctor puts you on a statin to lower the
Yeah.
cholesterol, and then you're on a statin, all of a sudden you don't feel good. Numbers are going down, but you don't feel good because you're lowering your steroid levels so much that your hormones are out of the whack. Now, you were taking the medication to feel better, but if you're not looking at the whole picture, like at Inspire Med Spa, just popping a pill is not always the answer. That's why you want to make sure men and women can definitely benefit from visiting Inspire Med Spa and seeing Dr. Castelluber and Christine.
We also like to take not just medications, looking at diet, looking at lifestyle. That's very
Exercise,
important. Exercise, sleep. All of this it's easy to just give someone a medication, but if you're not looking at all the other things that you're doing on the back end, the medication is only going to go so far.
You know, and I want to ask the audience as well. When was the last time you saw a doctor and the doctor actually asked these questions? You know, they look at the lab sometimes and things like that, but you know, we make sure at Inspire Med Spa, the Dr. Castle and Christine will make sure that they're taking time with you to learn all about you and your lifestyle approach so that they can find the right regimen for you. And at HB Pharmacy, we'll be able to help with that as well. Thank you so much today for coming by and
Thank you for inviting us.
Thank you
in
for
this
having
video.
us.
And then stay tuned for more videos and please hit that subscribe button for more good info. Thank you.
Thank you.
Thank you.